Hello, my name is Dr. John Wessling, and I have been a chiropractor here in the Wichita area since 1975. And I'm going to talk to you about degenerative, bulging, and herniated disc, and what causes them and what can be done. Now first, your back or your spine is made up of many parts consisting of 33 bones or vertebrae. You have 7 here in the neck, 12 in the mid-back, and 5 in the lower back. Now as you see on this plastic model, sandwiched between each of the vertebrae here is a disc that acts as a shock absorber. Now, as seen on this picture, each disc is made up of a tire-like outer band called the annulus fibrosus, and on this other picture is a jelly-like inner substance called the nucleus pulposus. And together, the vertebra and disc provide a tunnel to house the spinal cord and spinal nerves. These nerves run down the center of your vertebra and exit to various parts of your body. Your back also has muscles, ligaments, tendons, and blood vessels. Now the muscles are strands of tissue that act as a source of strength and power for movement. Ligaments are strong, flexible bands that connect the bones together, and then tendons connect muscles to bones and disc. Then you have your blood vessels that provide nourishment. And all these parts work together to help you move around. Now disc will either degenerate, bulge, or herniate. Disc degeneration occurs during the early stages when the nucleus pulposus weakens due to chemical changes in the disc associated with age, but with no disc bulging, as you can see at the second level showing a degenerated disc. A disc bulge occurs when the tough outer fibers, the tire-like substance of the disc, in other words the annulus fibrosus I mentioned, weakens and stretches along the jelly center called the nucleus pulposus to bulge outward. Now the bulge typically affects a large portion of the disc, so it may look like a hamburger patty that's too big for its bun when it stretches out over the vertebra, as you can see at the third level showing a bulging disc. A herniated disc occurs when the nucleus pulposus leaks out of the annulus fibrosus, as seen at the fourth level showing a herniated disc. Now disc problems are 10 to 15 times more common in the lower back than in the neck. By 30 years of age, your disc, which are 80% water, have already begun to dry out, and by the time you reach your 50s, your discs are considerably more rigid and dry and provide less cushioning. Now the fibrous exterior, in other words the annulus fibrosus, may begin to weaken and tear. Now to look at your disc problem from a different perspective, this is done by looking down on your spine. You can see two different pictures. The one on your left shows a normal vertebra, disc, spinal cord, and nerve roots. And then on the right you can see the difference. The disc here has herniated, causing nerve root and spinal cord compression. And when the disc has protruded far enough into the spinal canal to touch a nerve, you feel symptoms of pain and numbness. Now to determine the source of your problem in providing the appropriate treatment and rehab is in taking a complete history of the difficulties that you are having. Then doing a comprehensive physical and neurological exam, which is necessary in finding the cause of your pain by observing your posture, range of motion, your physical condition, both standing and lying down, the types of movement that causes your pain, like when you bend or twist or move. Also check your muscle tightness and stiffness, and for any loss of normal spinal curvature that may be due to muscle spasms. We will then do a test called straight leg raise, which is done by having you lie down and extend your hip with your knee bent, and this is done to see what produces or makes your pain worse. And this may indicate whether or not you may have a disc problem. Then walking on your toes or heels is done to test your motor skills. Now we also want to test you neurologically. Now we do things differently in our office. We use brain-based treatments. Now, what controls your back and your spinal muscles as you can see right here, is a part of your brain called the cerebellum, located right in through here. Now, your cerebellum controls balance and coordinated movement. And like I mentioned, it also controls all of these postural spinal muscles here. So if the cerebellum is not functioning or not working correctly, then the back muscles will spasm and the vertebra will lock up, and since the disc has no blood and nerve supply, and the only way it gets nutrients is through motion, so if the disc doesn't move, then it's going to bulge or herniate. So that's what's happening neurologically. So we not only want to address your back problem itself, but we also want to get your cerebellum working again. So how do we know that your cerebellum is working right? Well, we do certain tests. And we do that by having you stand with your eyes closed and your arms to your side, and we notice whether or not you do any swaying or not. That's one test. Another test is to bring your arms out in front of you with your eyes closed, and we bring your finger towards your nose. And if you find that your finger ends off over here in your cheekbone or up here in your forehead or someplace other than your nose, then we know that that's a cerebellum problem as well. Another test that we may do is having you stand with your finger above, your index finger above your head, with your head tilt back, and the opposite index finger brought up to touch your other finger. If you find that one finger is out in front of the other or behind the other, then we know that that's a cerebellum problem as well. So these are just some of the tests that we do for the cerebellum. Now, x-rays can be helpful in identifying disc problems, but MRIs are really the gold standard to identify the exact nature of the condition of your disc. Now, depending on your history and examination, non-surgical decompression is one of the therapies that has been effective in treating disc problems. Non-surgical decompression actually separates the vertebrae, which creates a negative pressure within the disc space, causing a vacuum effect. And this vacuum effect actually draws or sucks the disc material back inside. So you don't have that bulge or herniation putting pressure on that nerve anymore. Spinal decompression also provides a slow stretch to the muscles that fires electrical impulses into the spinal cord here and then up to the cerebellum. So our specialty is not in just looking at your disc problem, but your entire body, your nervous system, your cerebellum, but also your metabolism and diet, because in a lot of cases that can be a factor in causing not only disc but spinal problems as well. Now, you may not realize that what you do to yourself and what you eat causes inflammation and can irritate your sensory nerves. So if you suffer from bulging and herniated disc and you are looking for a doctor that will sit down with you to find out who you are, how you've been treated, and be able to provide you with some hope, then please fill out the area below for an online link to a video that will explain all the different treatments that we do that make our care so unique and successful.